Lucky Land Casino, asking people, what's the weirdest place you've gotten lucky?
Lucky? In line at the deli, I guess?
Aha, in my dentist's office. More than once, actually.
Do I have to say?
Yes, you do.
In the car before my kids' PTA meeting.
Really?
Yes.
Excuse me, what's the weirdest place you've gotten lucky?
I never win and tell.
Well, there you have it. You can get lucky anywhere, playing at LuckyLandSlots.com. Play for free right now. Are you feeling lucky? No purchase necessary. Void where prohibited by law. 18 plus. Terms and conditions apply. See website for details.
Hey all, welcome back to the Real Life Pharmacology Podcast. I'm your host, pharmacist Eric Christensen. Thank you so much for listening today. As always, head to reallifepharmacology.com and check out the free 31-page PDF I have on the top 200 drugs. It's a great little resource for anybody looking to brush up on their clinical skills, as well as a prep tool if you're looking at board exams or pharmacology exams in school there. So go take advantage of that. Let's get into the drug of the day today, and that is hydroxyzine. Brand name of this medication that I've seen thrown around most often is Atarax or Vistaril. And mechanistically, hydroxyzine can cause a bunch of different effects. It's primarily categorized as an antihistamine in that it blocks H1 receptors. So remember, H2 receptors are more in the gut relating to acid secretion and things like that. So that's like your famotidine, for example. Histamine 1 blockers give you more of the anti-itching, anticholinergic, antihistamine, allergy relieving, those type of effects with that. So that kind of feeds into uses and what this medication is used for. So probably in clinical practice, I see it used for 2 or 3 different things on a pretty regular basis. I would say the most common 2 are itching and anxiety. And it can be used on an as-needed basis, and I'll touch on that a little bit in the kinetics section. But for straight allergies like, postnasal drip and symptoms like that, you're typically not going to see hydroxyzine used for that, even though technically it is classified within the same category as, a diphenhydramine. So itching, anxiety, I have seen it used on occasion for analgesia or potentially like muscle spasms, that type of thing. Usually it's in patients that can't tolerate, other medications. So, if a patient can't tolerate opioids, or maybe they've got a history of addiction and dependence abuse, if maybe NSAIDs aren't any good for them for some reason, or they cause harm, acetaminophen doesn't work well, that might be a situation in which I've seen it kind of used off-label for analgesia relief and spasms. And then on occasion, I will see it dosed just PRN at night, and usually that's going to be for sleep, and or sometimes patients that struggle with itching at night might be prescribed hydroxyzine PRN for that. Okay, so let's tie this in a little bit to the adverse effects. So if we're going to potentially give this medication for sleep or to help with insomnia issues, obviously sedation is a primary concern that we need to pay attention to. It being an older first-generation antihistamine, it's going to have anticholinergic effects. So that's going to be particularly problematic in our elderly patients. We're talking about dry eyes, dry mouth, confusion, urinary retention, constipation, potentially increasing the risk of falls. So again, be super, super careful with a drug like hydroxyzine in the elderly. And I know that gets really challenging in practice. Let's say we've got that, pain patient that can't do opioids, or NSAIDs aren't a good choice either. It gets really challenging, and you basically have to decide between, maybe 2 or 3 medications that aren't good or could cause some significant harm there. So, again, very, very challenging, but important to think about for sure. A couple of diagnoses that I think about as I'm, reviewing a medication list, for example. So if a patient has, gastroparesis or diabetic gastroparesis, hydroxyzine is going to potentially worsen that by slowing down the gut further. You might get more, symptoms of nausea and things like that for patients. So keep an eye on that with the anticholinergic effects. And then, of course, BPH as well. So hydroxyzine could worsen that urinary retention and make people have some acute reactions, acute situations where it's a severe type of scenario there. All right, so I think we'll move on to kinetics now. I mentioned that I do see this drug quite a bit used as a PRN type medication and as needed type medication. And the reason it's helpful for that is that it does have a quick onset. When we think about management of anxiety, especially in the acute short-term situation, first you're probably thinking of benzodiazepines like lorazepam, for example. But in a patient that maybe can't tolerate those, or we're risking dependence, or maybe there's on a bunch of opioids already or something, and we really want to avoid additive risks of a controlled substance, of a benzodiazepine. That's a situation where I have seen hydroxyzine used kind of for that acute relief of anxiety. Now, how well it works sometimes, I mean, that's, I've seen it go both ways, where sometimes it doesn't work very well and sometimes it can. So a little bit of patient variability there for sure. And of course, dose matters as well. We don't want to overly sedate patients, but we want to have an adequate dose to be able to manage anxiety too. So that's going to be kind of a tightrope to walk based upon patient age and all sorts of other factors there. Another thing to think about, I mentioned not, the greatest drug in the elderly due to the anticholinergic effects. As with a lot of drugs, hydroxyzine fits the bill in that elderly patients generally don't, break it down, clear the drug as quickly as younger patients. So, for example, the half-life in, your average adult patient, maybe around 20 hours. For hydroxyzine in an elderly patient, that half-life may be closer to 30 hours. So again, we really need to be careful with accumulation and frequent use. And if you've got somebody that it is dosed PRN and not scheduled, we've got to be sure that we're assessing that. How frequently are they using, and what's the risk of drug accumulation and kind of an exacerbation and a worsening of some of those adverse effects that I laid out there. All right, so let's take a quick break and we'll wrap up with drug interactions. If you're in the market for pharmacist board certification study material like BCPS, NAPLEX, ambulatory care, MTM, geriatrics, go check out meded101.com/store. Your support there helps support this podcast. There's other ways to support this podcast as well. I've got a whole list of resources for other healthcare professionals as well, books, case studies, things of that nature. All those things are at meded101.com/store, STORE. And then, of course, lastly, we do have the free Audible book promotion. If you've never tried Audible, again, you can get one free Audible book. I'd probably recommend my drug interaction book or pharmacotherapy. Two great Audible books there, Thrill of the Case. Three great Audible books there with lots of case studies, scenarios, and then, of course, the drug interaction book is more focused on drug interactions specifically. So, again, meded101.com/store. Okay, keeping on the topic of drug interactions there, let's talk hydroxyzine drug interactions. First and foremost, I think about anticholinergic effects. I think about anticholinergic burden. Are they taking other medications that have anticholinergic activity? Let's say an oxybutynin for, urinary purposes, maybe a tricyclic antidepressant, maybe cyclobenzaprine. maybe other antihistamines. All of these can potentially worsen that anticholinergic burden and contribute to some of the side effects I talked about earlier. In addition, anticholinergic effects can blunt dementia medications. So your acetylcholinesterase inhibitors, for example, your rivastigmine, your donepezil, those drugs' potential benefit, which maybe aren't the greatest benefiting drugs to dementia to begin with, could even be blunted further by a drug like hydroxyzine. Adverse effects, I mentioned sedation, so you've got to think about other CNS depressing type agents, benzodiazepines, opioids, and so on and so forth. Those can have a cumulative type effect. QTc prolongation, it is listed, not something I'm crazy worried about, unless that patient is on a lot of other medications that can cause QTc prolongation, quinolone antibiotics, amiodarone, and so on and so forth, or they have potential risk factors that could lead to QT prolongation and risk for cardiac complications there as well. So, not high on my list, but it is listed and potentially something to think about with hydroxyzine, particularly in a patient with other risk factors or medications. And then the interaction with oral solid dosage forms of potassium comes up, and that's pretty much with any medication with anticholinergic properties. There's the risk of kind of drying the mouth as well as maybe slowing the gut, and that potassium supplement basically sticking within the esophagus area and causing an ulceration basically. And that has been reported in the literature, and it definitely is something to think about if we've got our patient on high amounts or significant amounts of anticholinergic type medication. All right, so that's going to wrap up the podcast for today. Thank you so much for listening. If you enjoyed the show, leave a rating, review on iTunes or wherever you're listening. So appreciative to those of you who have done that. Go support our sponsor, meded101.com/store, and obviously head to Real Life Pharmacology and get updates there on when we've got new content available. And I did want to mention a little special announcement. I am working on a book regarding polypharmacy and the prescribing cascade, and basically kind of strategies to reduce medications, as well as a lot of strategies on things I've seen that have kind of led to the prescribing cascade and some of the challenges with polypharmacy. So going to be lots of case studies in there, as well as kind of breaking down some of the most common medications that I see lead to issues in clinical practice. So something to look forward to. And obviously, if you subscribe at reallifepharmacology.com, you're going to be the first to know, because I'm going to send out an email when I've got that available. And many times I've made it so there's a huge discount when I first release a book, because I want people to have it. I want people to learn from it, of course. So with that said, you can reach me, track me down, Eric Christensen, PharmD, BCGP, BCPS on LinkedIn. That's probably the best way. Otherwise, email works pretty well, good as well. mededucation101@gmail.com. And if you have comments, suggestions, definitely reach out and let me know there. So, signing off for today. Thank you so much for listening. Have a great rest of your day.
Okay, round two. Name something that's not boring.
A laundry? Ooh, a book club. Computer solitaire, huh?
Sorry, we were looking for Chumba Casino. That's right. ChumbaCasino.com has over 100 casino-style games. Join today and play for free for your chance to redeem some serious prizes. ChumbaCasino.com. No purchase necessary. Void where prohibited by law. 18+ terms and conditions apply. See website for details.